Kidney damage doesn't start in a doctor's office. It starts in the toilet bowl, weeks or months before any blood test would catch it. Here's the reframe. By the time a standard blood test flags a kidney problem, you've often already lost a significant chunk of kidney function. That sounds alarming, but here's the empowering part. Your kidneys leave clues in your urine far earlier than they show up in your blood. And once you know what to look for, you can catch problems while they're still reversible. By the end of this video, you'll know the 5 things your morning urine can tell you about your kidney health, the one home test you can do for under $10, and the daily habits that actually protect kidney function long term. If you can already describe what your urine usually looks like first thing in the morning, you're ahead of most people. If you have no idea, that's useful information too. It means you've never been paying attention to one of the easiest health signals your body gives you for free every single day without you having to do anything extra. Stick around because understanding why your kidneys behave this way will make everything else in this video click into place. The what to do only makes sense once you understand the why it works. I am Dr. Mark. If this kind of practical health breakdown is useful to you, hit subscribe and tap like. We're trying to reach 100,000 people who actually want to understand their bodies instead of guessing. Think of your kidneys as a pair of incredibly fine coffee filters, running non-stop 24 hours a day, filtering about 50 gallons of blood every single day. That's not a typo, 50 gallons. Your entire blood supply passes through this filter system roughly 40 times a day. That filter is made of millions of tiny units called nephrons. Picture them as microscopic strainers, each one deciding what stays in your blood and what gets passed out as waste. Each nephron is doing this job independently all day without you noticing any of it. When those filters are healthy, they're selective. Waste and excess fluid pass through into your urine. Useful things, protein, blood cells, nutrients, stay in your bloodstream where they belong. That selectivity is the entire job. A healthy filter knows the difference between trash and treasure. Here's the causal chain. When the filter gets damaged from high blood pressure, high blood sugar, dehydration, or inflammation, the mesh gets a little looser. A looser mesh lets things through that shouldn't escape, like protein, and sometimes microscopic amounts of blood. That leakage shows up in your urine before it shows up as a problem in your blood, because your blood compensates for a long time before it can't anymore. That's the key idea. That's not your kidneys suddenly failing. That's your kidneys quietly signaling a strain long before your blood work would notice. And this happens silently. No pain, no obvious symptoms, just small changes in color, smell, foaminess, and frequency that most people never learn to read. Your kidneys don't have pain receptors the way your skin or muscles do, so there's no built-in alarm system the way there is for, say, a broken bone. The alarm system that does exist is sitting in the toilet bowl every morning, and most of us flush right past it. Myth bust number 1. Most people think, I'll know if something's wrong because I'll feel it. That instinct makes sense. Your body usually does tell you when something hurts. A sprained ankle hurts immediately. A burned hand hurts immediately. So it's reasonable to assume internal organs work the same way. But kidneys are different. They have huge reserve capacity. You can lose close to half your kidney function and still feel completely normal because the remaining healthy tissue compensates and covers for the damaged parts. That's the checkpoint that fails you. By the time pain or visible symptoms show up, the compensation system is already overwhelmed, and you've lost more ground than you'd think. Take Marcus, 44 years old, felt fine, energetic, no complaints, ran 3 miles a few times a week. At a routine checkup, his doctor noticed slightly foamy urine he mentioned offhand, almost as an afterthought. A urine test showed protein leakage his blood work hadn't picked up yet. Marcus had early-stage kidney strain from years of unmanaged blood pressure, and he had 0 symptoms. The catch came from urine, not from how he felt, and not from how fit he looked on the outside. Myth bust number 2. The second mistake is thinking, I drink water sometimes, so I'm probably fine. Drinking water occasionally is like vacuuming your living room once a month and assuming the whole house is clean. It helps, but it's not consistent enough to count as real protection. Sporadic hydration doesn't give your kidneys what they need, a steady, predictable fluid load that lets them flush waste efficiently all day, every day. Your kidneys aren't built for feast or famine. They're built for steady state operation, hour after hour. Take Priya. She drank a big glass of water in the morning and figured that covered her for the day. Her urine was consistently dark and concentrated by afternoon, a sign her kidneys were working harder than they needed to, trying to do the same filtering job with far less fluid to work with. Once she spread her water intake evenly through the day, instead of front-loading it, her urine color normalized within about 2 weeks, and she felt noticeably less fatigued by evening, less foggy by mid-afternoon, and her headaches, which she hadn't even connected to hydration, became far less frequent. Before we get into it, a few ground rules. Do these checks once a day, ideally with your first morning urine, since it's the most concentrated and informative sample your body produces. Start simple, just observing, and only add the home test strip once observation becomes second nature. If anything looks off for more than a few days in a row, that's your signal to escalate, not panic. One off day means nothing. A pattern means something. 1. Check the color. Look at your urine in good light, not your dim bathroom at 6 a.m. Pale yellow to light gold is the healthy range. Color reflects concentration, which reflects hydration, and how hard your kidneys are working to balance fluid. Do this for 10 seconds every morning before you even reach for your toothbrush. 2. Watch for foam. A little foam that disappears quickly is normal. Persistent, frothy, bubble bath-like foam can indicate protein leaking through a damaged filter. This works as an early signal because healthy filters block protein almost entirely. So foam that doesn't go away is worth noting for 3 days running before you draw any conclusions. 3. Smell check. A faint smell is normal. A strong ammonia smell that's new and persistent can signal concentration or infection. This matters because smell intensity correlates with waste concentration in the urine. One sniff once a day costs you nothing and takes less time than checking your phone. 4. Track frequency. Healthy kidneys produce urine roughly every 3 to 4 hours while you're awake and hydrated. Sudden drops in frequency or volume can signal reduced kidney function or dehydration. Keep a rough mental count for 1 week to establish your baseline. Then just check in periodically after that. 5. No color changes after specific foods or meds. Beets, certain vitamins, and some medications change urine color temporarily. That's normal and harmless. Knowing your own patterns helps you tell normal variation from real signal, so you're not panicking over a beet salad from last night. Spend 1 week just learning your own baseline before you start interpreting anything as unusual. 6. Use a home urine test strip. These over-the-counter strips test for protein, blood, and glucose in urine, working through a simple color change reaction on the strip that you compare against a chart. They give you a more objective check than eyeballing alone, catching things your eyes might miss entirely. Use one strip once a week as a baseline check. 7. Track blood pressure alongside urine signs. High blood pressure is one of the biggest drivers of kidney filter damage, and the two systems are deeply linked. The kidneys help regulate blood pressure, and blood pressure damages the kidneys when it's too high for too long, creating a feedback loop. This works because it lets you catch the upstream cause, not just the downstream symptom. Check your blood pressure once a week, more often if it's been high before, using a basic home cuff. 8. The hardest but most effective step. Build consistent, spaced out hydration. Don't chug a liter at once. Spread water intake across the day in smaller amounts so your kidneys get a steady workload instead of sudden spikes followed by long dry stretches. This works because consistent flow reduces concentration spikes that stress the filtering system over time. Aim for roughly 8 cups spread across 12 to 14 waking hours, adjusted for your body size, activity level, and climate. Take David, who started this routine after Marcus's stories stuck with him. The first week, he kept forgetting to check before flushing. Habit is hard to build, and he missed more days than he caught. By week 3, the morning glance had become automatic, almost like checking his phone before getting out of bed. By week 6, his home test strips were consistently clean, and his urine color had stayed pale and steady for nearly a month. Nothing dramatic happened. That's the point. Quiet, boring consistency is what kidney protection looks like. There's no finish line moment, no big reveal, just a slow accumulation of small, repeated checks. Quick question for you. How old are you? And have you ever actually had your kidney function tested? Drop it in the comments. It helps me figure out whether to make a deeper dive on reading lab results next or focus more on these daily home checks instead. Here's the core idea to remember. Your kidneys give you signals in your urine long before they show up in your blood, and most people never learn to read them. The premise behind everything we covered is simple. Your kidneys function better when you give them steady, consistent inputs. Steady hydration, steady attention, steady awareness. Stick with these checks for a few weeks, and many people start noticing patterns they never saw before. Clearer color, less foam, more predictable frequency, fewer afternoon headaches. That awareness alone often leads to better hydration and earlier catches if something's actually wrong, long before it would ever show up as a number on a lab report. If you ever notice persistent foam, blood-tinged urine, a big drop in frequency, or swelling in your legs or face, that's worth an actual conversation with your doctor. Not a reason to panic, just a reason to check. A simple blood and urine panel can rule things out quickly and give you peace of mind either way. This video is educational, not a substitute for personalized medical advice. If you have existing kidney concerns or risk factors like diabetes or high blood pressure, talk to your doctor about what monitoring schedule makes sense for you specifically. If this helped you understand your own body a little better, hit subscribe and like. We're working toward 100,000 people who want real, practical health knowledge instead of guesswork. Thanks for watching, and I'll see you in the next one.